Public service announcement. There is now a major ENT national clinical trial underway across the UK, and if it's going to work, then we need as many people as possible to know about it. Here's why. You'll have seen me post a lot on my page about the fact that sudden hearing loss should be treated as an emergency, not to miss the boat for urgent treatment, not to mistake it for congestion. And as you can imagine, the sudden loss of a vital sense can be absolutely devastating, and even more so because it tends to affect fit and well young people out of the blue who didn't even know that it was even a thing. And furthermore, we may not even be able to prove the cause. In fact, some of you who follow this page may have even found it after suffering this yourself. Now, there are two broad types of sudden hearing loss, and I'm talking specifically about sudden sensorineural hearing loss. That's affecting the microphone part of your inner ear. Now, ideally, your doctor can use a tuning fork to distinguish between sensorineural hearing loss and conductive hearing loss that congestion usually causes. And you can also do a test at home if you lose your hearing by humming. And if you hum and you hear the sound louder in the opposite ear to the ear that's been affected, then that should trigger the alarm that this is a sensorineural hearing loss emergency. And this happens to an estimated 5 to 20 people in every 100,000, so you're very likely to at least heard of or know someone that this has happened to. Now, there's lots we don't know about why this happens to people, but what we do know is that the best hope of salvage and rescue and recovery is to give steroids as early as possible. The big question remains, though, is it better to give steroids via tablets with the associated side effects that that can bring, or to do a series of injections of steroids through the eardrum with the skill that that involves and the invasiveness and risk that comes with it? And so the Starfish trial is going to be a UK multi-centre national randomised control trial. That's the kind of trial that generates the highest level of evidence available, and patients who are suitable and enrol in this trial as an emergency will be randomised to either having steroids via tablet, a series of steroid injections through the eardrum, or both together, so that we can find out which treatment arm is the best. The Starfish trial is going to be available for any adult who is within 4 weeks of having a sudden sensorineural hearing loss, and crucially, who hasn't yet started treatment. And so the more people across the country we can make aware about this condition and this trial, the more chance we've got of recruiting enough people to generate a high level of evidence. And the better the evidence we generate, the more people in the future are going to be helped in their hour of need during this devastating condition. And of course, the crucial thing here is that the Starfish trial requires that patients aren't treated before enrolment. And that's slightly counterintuitive because we're always labouring the importance of starting steroids as soon as possible. But instead of starting steroids in this case, what needs to happen is that the patient needs to be referred urgently to one of the many centres across the UK enrolled in this trial. And so for that to happen, it's going to need awareness amongst general practitioners, audiologists, specialist nurses, pharmacists, all the kinds of professionals that see people with ear problems, and of course patients themselves and their families. I'm going to share some links below to how to find out more about this trial, and as with all the content on my page, none of this is sponsored. I just feel passionately about getting the best outcomes for patients in the future, and all the major people in UK otology are going to be involved in this trial in some form. So thanks for watching this far. Please do consider sharing this video. Are you involved in this trial? Are you a patient that's had sudden hearing loss and wish there were better treatment options out there? I'd love to hear your testimonies in the comments below.